We trust them to take care of us when we're sick, but their own health is being called into question as a growing number of doctors admit they're getting burned out. News 5's Mike Brookbank takes a closer look at some of the factors putting physicians and possibly their patients at risk.
What do patients want? They want a relationship with a doctor.
However, getting the time,
Or they want a doctor who's not rushed and typing through the visit.
and undivided attention to do that is more challenging these days.
Physicians are forced to work more after hours.
The pressures of the profession starting to take their toll.
54% of physicians reported that they had at least one symptom of burnout.
The condition goes beyond just emotional exhaustion.
They're feeling unhappy with their work. They're feeling far less satisfied.
Dr. Sharona Hoffman is a health law professor at Case Western Reserve University.
They're frustrated, and when you're not as happy, you often don't do as good a job.
She tells me one of the driving forces behind the burnout
Patients seen by cardiologists,
is the amount of time doctors spend keeping track of a patient's medical history in this digital age.
In a 10-hour shift, you have 4,000 clicks that you go through on the electronic health record system. 4,000 in a one-day shift.
That in-basket is there 24/7.
Dr. Fred Jorgensen tells me it's not just an imbalance in their workload.
We'll contact patient, PSA is normal.
Insurance company authorizations add insult to injury.
One of my colleagues just spent 23 minutes on the phone trying to get an MRI approved for a patient. And the need for it was obvious.
The Ohio Physician Wellness Coalition just today launched a series of videos like these to increase physician resiliency.
Here's my advice. You should be meditating every day.
They focus on improving time management, identifying mental health issues, and provide tools to cope.
Like meditation, counseling, exercise plans, things like that to help me.
Dr. Hoffman tells me health systems need to also do their part to try and keep the doctors they have.
A lot of physicians are leaving clinical practice and trying to find jobs that are administrative in nature.
But to also make sure they can attract new ones.
There is an issue with recruitment as well.
Dr. Jorgensen believes they can do that by paying closer attention to their total workload and push for changes in the regulations that get in the way of patient care.
If you hurry too much, mistakes get made. You know deep down you're not doing it right. You're doing it quick. And that's not why we went into this field.
Reporting in Cleveland, Mike Brookbank, News 5.